When confronted with a diagnosis of cancer, especially breast cancer, the fear is overwhelming. And it's fear for us, but it's fear for our children and our family members and our community. And how are we going to get through this? And it's fear of what will happen if I'm not here. And probability is, thankfully, and chances are, that once you go through your treatment, you're never going to have another problem from breast cancer again. But at that initial diagnosis, that's very difficult to believe. And we have, as part of our team at Nuvance Health, social workers who specialize in oncology.
A social worker for cancer, what we do is we provide resources. We're talking to the patient, checking in to see how they're doing emotionally, how are they coping with their diagnosis. We have a conversation asking about specifics about their life. We discuss housing resources, how is their home life, what does their home life look like, what kind of supports do they have at home. We also help by talking about what their employment might look like, if they're planning on working throughout treatment. Are they planning on telling their job, or are we keeping it a little more confidential and just working around the schedules? Are we helping them to advocate for taking time off through FMLA, things like that? The amazing part about this program is the collaborative teamwork that we have here. I work closely with my nurse navigator here, so any appointments that come up or questions about appointments, even things that are kind of outside of our initial treatment plan, like, hey, I'm trying to get in with, this doctor or that one, I can then go to my nurse navigator and run it by her. We can start to look for other specialists to get them in with, take that load off of them with scheduling them. In groups, sometimes it comes up, the side effects, dietary concerns or side effects from treatments. So then we can offer that referral to a dietitian. So it is really nice to be a member of a team too, because we all work together. We all have our specialties and we come together to treat the whole person.